my name is Niels van der Donk from Amsterdam University Medical Center in the Netherlands. And today I will tell you something about the Tocilizumab prophylaxis cohort in the MajesTEC-1 study. Teclistamab is a BCMA targeting bispecific antibody with high efficacy in relapsed refractory multiple myeloma. One of the most important adverse events is cytokine release syndrome, which is characterized by fever or sometimes, but not commonly, hypotension or hypoxia. We managed cytokine release syndrome with Tocilizumab, and in this study, we looked at the value of Tocilizumab given before the first step-up dose of Teclistamab to mitigate cytokine release syndrome, so to reduce the frequency of cytokine release syndrome. We have previously shown some data with a short follow-up of 2.6 months, and now I will present data with longer follow-up of 8 months. So in the study, we give Teclistamab according to the approved schedule, 2 step-up doses and then a full dose, and we give Tocilizumab before, together with dexamethasone, and paracetamol, and an antihistamine. So we included 24 patients in this prophylactic Tocilizumab cohort. And here you can see that 20% of the patients had extramedullary plasmacytomas and 20% of patients had more than 60% plasma cells. And with prophylactic Tocilizumab, so Tocilizumab given before the first step-up dose, we can reduce the frequency of cytokine release syndrome from 72% without toci to only 25% with toci. So there were only 6 patients that experienced cytokine release syndrome, and most of these had low-grade CRS, and all these events resolved. There were no specific disease characteristics that were associated with cytokine release syndrome, which is consistent with the pivotal cohort. We also looked at the side effect profile of prophylactic Tocilizumab, and there was no impact on the side effect profile when we gave Tocilizumab before the first step-up dose of Teclistamab. And this slide shows you that there was also no impact of prophylactic toci on efficacy of Tocilizumab. So we have a 72% response rate with prophylactic toci, which was similar as observed in MajesTEC-1. Here you can see some PK data, and when you block the IL-6 receptor with Tocilizumab, IL-6 peaked earlier, and also the peak was higher. And this can be explained by the fact that you're blocking IL-6 receptor-mediated IL-6 clearance. Importantly, the duration of IL-6 signaling blockade spans the Teclistamab step-up dosing schedule, supporting the approach for lowering the overall risk of cytokine release syndrome during Teclistamab step-up dosing. So in conclusion, the incidence of cytokine release syndrome with Teclistamab can be reduced substantially with prophylactic toci from 72% to 25%. There was no negative impact on side effect profile, no negative impact on response. So we think that prophylactic toci can be considered to mitigate risk of CRS, not only in the clinic, but also in the outpatient setting, so that patients do not have to be hospitalized. And there was also another poster at ASCO that showed that prophylactic toci was indeed effective in managing outpatient Teclistamab usage.